Hello nurse, welcome back to my channel. Today let's discuss about the principles of first aid. Let's see the definition of first aid. First aid is a temporary and immediate treatment given to a person who is injured or suddenly becomes ill, using facilities or materials available at the time before regular medical help is imparted. And let's see the objectives of first aid. The objectives of first aid are to preserve life, to prevent further injury and deterioration of the condition, to make the victim as comfortable as possible, to conserve strength, to put the injured person under professional medical care at earliest. And coming to the principles, the general principles of first aid are restoration, respiration, control bleeding, treat shock, care unconsciousness, fracture, burn, multiple injury, transportation of the patient if necessary. The first aider. A first aider is just a common person who may have learned a standard method at application of first aid best suited to his skills. He is trying to reach patients, identify the problem, and provide emergency care and, when necessary, move patients without causing further injury. Qualities a first aider should have: should be a good observer, should be able to act quickly, should not get panicky or excited when he or she sees the person at that situation, should have the ability to lead and control the crowd and take help from the onlookers who are surrounded around that person in the situation, should have self-confidence and able to judge injuries to be tracked first, should be able to reassure the apprehensive victim and his or her anxious or nervous relative by demonstrating competence, expressing sympathy and providing good counseling. Responsibilities of a first aider: gain access to the patient in easiest and safest way, observe the accident scene and assess the situation. If necessary, direct others' traffic, keep bystanders at a safe distance, and make essential telephone calls, turn off all engines that may be still running, to find out whether casualty is unconscious or conscious, alive or dead, identify the disease or condition from which the casualty is suffering, give immediate, appropriate, and adequate treatment considering priority of first aid measures, such as first priority will be of restoration of breathing and circulation, while second will be stopping the bleeding. Should bear in mind that a casualty may have more than one injury and that some casualties will require more urgent attention than others. Arranging without delay for shifting of casualty to a doctor, hospital, or home according to the condition in such a manner as not to complicate the injury or subject the victim to unnecessary discomfort. Keeping the records of the patient and of the incident, addresses, and witnesses. Once a first aider has voluntarily started care, he should not leave the scene or stop the care until a qualified and responsible person relieves him. When the responsibility of a first aider ends, the responsibility of the first aider ends when the casualty is handed over to the care of doctor, a nurse, or the appropriate person. Later on, he may assist the doctor. Warnings to the first aider. First aider should keep in mind that he is not a doctor. He should not examine wounds by opening which have already been damaged by someone else. He should not declare any person as dead. It is not in his scope. Let's see what are the scope at first aider. In accidents which may take place either at road, home, in factories, buildings, or as such as a result of natural calamities, electric shocks, burns, snake bites, etc., he can give care in such incidents. Golden rules of first aid. Do first things first, quickly, quietly, and without panic. Reassure the casualty and his relatives sympathetically. Look for the following things like: is there any failure of breathing? If yes, start artificial respiration. Is there any failure of circulation? If yes, start external cardiac massage. Is there severe bleeding? If yes, stop bleeding by pressing on the pressure point. Press firmly on the bleeding area with a clean pad and keep on pressing the bleeding area for at least a few minutes. Avoid handling the casualty unnecessarily. Arrange for the safe removal of casualty to care of a doctor or hospital as soon as possible. Kit for first aider. The kit should contain triangular bandages, round roller type bandages, dressing or gauze pads, adhesive tapes, bandage sheets, eye protector, stick for tourniquet, blanket and pillow, upper extremity splint set and lower extremity splint set. Now let's discuss overall summary of first aider skill. Control the scene of accidents, gain access to the patient, evaluate the scene in terms of safety and possible cause of accidents, gather the information from patient and bystanders, determine vital signs like pulse, breathing, and skin temperature, determine the diagnostic signs, and relate those to possible injuries or sudden illnesses that require emergency care. Perform the necessary ABCs of emergency care. ABC is airway, breathing, and circulation. Diagnosis and care for shock. Diagnosis and care for soft tissue and internal injuries, including basic dressing and bandaging techniques. Detect and care for poisoning, including alcohol and drug abuse. Diagnosis and care for heart attack, stroke, diabetic, coma, insulin shock, and epileptic or other seizures. Diagnosis and care for facial injuries, head injuries, neck and spinal injuries, and chest injuries, including fractured ribs and penetrating chest wounds. Diagnosis and care for burns and smoke inhalation. Diagnosis and care for exposure to heat and cold, which includes heat cramps, heat exhaustions, heat stroke, hypothermia, and frostbite. Assist in childbirth and care of newborn. Psychological and proper emergency care of victims of crisis and disaster. Perform proper transformation techniques. If you like the content, please subscribe to the channel and share it to your friends. Also follow us on our Instagram, Nursewell25. Thanks for watching.